The American Muslim Health Professionals was created with the intent of bridging the tenets of Islam with key public health issues facing our communities. Over the past 15 years, AMP has provided outlets for Muslims in the healthcare sector to network and collaborate on issues that operationalize their faith by serving the community.
The idea behind AMP was simply to create a platform for Muslims who are working in diverse sectors of healthcare for professional development reasons, but more importantly, how can we come together to leverage our skill set, our educational background, and our expertise to work on public health initiatives for society.
We strive to assist healthcare professionals and students to excel in their chosen career paths by providing opportunities for networking, information sharing, and leadership building. We convene numerous sold-out networking events in various cities across the country. AMP's recent National Public Health Conference was held at the top medical school in the world, Harvard Medical School, in collaboration with Harvard School of Public Health. The conference provides attendees access to highly accomplished public health pioneers, entrepreneurs, and healthcare leaders.
And in all of our endeavors, we seek diversity in all its multiple forms. And to promote equity and social justice in our community,
AMP launched a membership campaign, which includes the first ever comprehensive national directory of Muslim health professionals and students. At AMP, we believe everyone has a right to healthcare, and our work and efforts exemplify that belief. AMP developed policy briefs and engaged congressional representatives on the critical role of Muslim-free clinics and the importance of comprehensive health reform. We launched national interfaith and national Muslim enrollment campaigns to raise awareness and ensure individuals are connected to healthcare coverage. In partnership with 80 organizations, we reached over 300,000 individuals in providing information about the Affordable Care Act. With efforts seeking to undermine and repeal the ACA, our members joined interfaith campaigns, vigils, and protests throughout the country to advocate for the uninsured and underinsured. AMP developed Healthcare Advocacy Toolkit and an Advocacy Chuppah Guide so individuals can use as a resource to protect everyone's equal access to healthcare. Through our mental health programs and initiatives, our mission is to destigmatize mental illness and improve mental health literacy. We've held national webinars with the Substance Abuse and Mental Health Services Administration and conducted Muslim youth identity panel discussions focusing on the impact of discrimination on a young person's well-being in a climate of prejudice and Islamophobia. AMP organized the first ever National Interfaith Anti-Bullying Summit at George Washington University to share research and best practices about an increasingly serious problem facing youth of various religious backgrounds, and published a report with the Institute for Social Policy and Understanding. Our mental health first aid certification trainings, an evidence-based program which introduces participants to risk factors and warning signs of mental health problems, are being conducted throughout the nation.
It leaves you with something like tangible that you could actually implement. This prepares you because it leaves you with actual things to say to them.
Over the years, AMP has received some of the highest honors, such as the White House Champion of Change Award, and was one of the 8 faith-based organizations to join former First Lady Michelle Obama's Let's Move initiative. AMP was invited to a private roundtable between a diverse cross-section of American Muslims and former President Barack Obama. With your support, we plan to build resources for Muslim-run free clinics across the country to treat uninsured patients and expand our advocacy program in Washington, D.C. and other cities. We intend to meet the growing demand for mental health first aid training, which provides an infrastructure for communities to identify and respond to mental health crisis, trauma, and substance abuse issues. AMP is growing and establishing chapters in different cities to continue our impact at the grassroots level. Muslims are mandated by their faith to look after one another's well-being and address the needs of the underserved, and this is AMP's mission. It is what drives our members to do the work they do to advance public health, social justice, and civic engagement within our communities.
And I thought about my 3-year-old son, that he would say, "But what else did you do? What did you do to change other people's minds? What did you do to fight what you saw when you saw all these communities suffering and not just ours?"